What is going on, everybody? What happened? Oh, I'm still here. I got scared. I got scared just now. Hey, what's up? Welcome. Hey, you guys. Today we are not doing any NCLEX questions. No NCLEX questions today, y'all. No NCLEX questions today. You wanna know why? We're gonna do a year. We're gonna reflect. We're gonna do some reflection today. So today is all going to be about a year of reflection about where you've been, where you were, like where you are, and then where you want to go for 2024. If you guys are just now joining, my name is Kevin. We're not doing any NCLEX questions today, y'all. We're not doing any NCLEX questions today. But we're going to talk nursing. We're going to talk nurses. We're going to talk NCLEX. We essentially can talk about whatever you guys want to talk about. You guys already know what the deal is. Smash that like button. Make sure you guys share. Make sure you guys follow. What's up, Heather? Heather Boo. What's the deal? Of course, I want to know who you are, where you're from, where you're at in your nursing journey. What are your biggest pain points? What are your biggest pain points? You know what I'm saying? So I'm looking for an FMP review. Right off the top of my head, there's one lady that I see. Her name is Sarah. I don't know the exact one. It's like Sarah, nurse practitioner or something like that. You can look those up. So that's one I would talk about specifically for NP. But hey, if you guys are just now joining, my name is Kevin. Been a nurse for 3.5 years. I've been a nurse for 3.5 years, worked in ICU, OR, PACU. I'm going to school to get my master's in nursing education right now. Been in the Navy for 16 years. So just a little bit of background about me, But I want to know what I want to know about y'all. From Montego Bay, Miss Ma'am, always here, always present, and always participating. I appreciate you. Love your videos. I appreciate you. I appreciate you being here. I appreciate you liking the videos. If you guys find value in those videos, hey, if y'all like it, I love it. I love to keep doing them. Hello, I'm from Canada, currently in school for LPN, worked as a CNA for the last 4 years. Is it Eileen? Shout out to you. Working as a CNA, hey, at least you're getting your foot in the door, understand what it's like to be a nurse or the nursing medical-esque area, right? Struggling to get the courage to start studying again, already failed 3 times. Hey, Lizzie, Miss Ma'am, I know that we are going to be having a conversation, I think, next week, if I remember correct, right? So you're struggling to get the courage. Well, trust and believe me. The only way that you can get the courage, first of all, it comes from within you. That's number one. Number 2 is nobody cares. Nobody cares about what you have going on. And it's all your fault. However, there's a dramatic pause there. However, what are you going to do to fix it? Usually with me, you get 24 hours to feel sorry. You get 24 hours to feel sorry for yourself in regards to anything. But you have to take action. You're discouraged because you don't know where to go. You don't know where to start. But the first place I'm going to tell you to start is to always look at your performance breakdown and then work yourself upon there. Hey, when we have our conversation, when we talk next week, we'll dive into that. All right. We will dive into that. I take my NCLEX next week. Shout out to you. Is it Ashlyn Ray? Shout out to you. I know you're prepared for it. Been an LPN for 1.5 years, and an RN for 21.5 years. Med Tele, Med Surge, and Step Down. Shout out to you. Or CV Step Down. Shout out to you. Outpatient Surgical Center and Psych. Shout out to you. Shout out to all 295 of y'all in here rocking with me. I want to know who you are, where you're from, where you're at in your nursing journey right now. I usually do NCLEX questions, but I'm not doing any today. Today's a year. Today we're going to talk about essentially like your year, and we're going to reflect. So whatever questions you guys have about, your nursing journey, how to become a nurse, if you're in school, courage, all that stuff. Megan, your jacket. What's up? How are you, ma'am? You did say you were coming back. So is it wise to take the language test if you can't pass the RN test? Well, you got to think is that the RN exam, the NCLEX is in English. So if you are not proficient in English, there's nothing. It would make sense so you could understand what they're truly asking you. Finishing up my doctorate degree in family nurse practice. Shout out to you. From Long Island, new grad. Shout out to you. 40-year-old RN part-time nursing home. Shout out to you. I'm a nursing school in Delaware. I'm afraid I'm not going to make it past NCLEX. Why, Frenchie? Why? LPN, not language. Okay, I got you. I'm tracking. I started my RN journey because I lost my mom to cancer. I knew after that, that's what I wanted to do. Shout out to you. So here's the question, what is your why? Why do you want to become a nurse? Everybody, the one thing that I don't want to hear people say is just I want to become a nurse because of the money. In reality, there's a lot of other professions that are out there that you can make way more money in. However, nursing is very lucrative because once you get your license, you're the CEO of that license and you can pretty much determine on what you want to do and where you want to go from there. The one thing I will tell you is that just because you're an RN or an LPN or whatever your equivalent is based off of what country that you live in, you do not, just because you have those licenses does not mean you have to work bedside. It does not mean that at all. Tamara says, I failed 2 times, third semester of RN program, having to start over in AR. I'm guessing that's Arkansas, right? So shout out to you. The question is, what are you going to do? Like, you failed twice. Hey, remember, you guys are delayed. You're never denied. You're delayed, never denied. There's still always opportunity for you guys to go out there and to rock out being a nurse. Is it Shayna says, I just scheduled my NCLEX, taking in a few weeks. Shout out to you, Miss Ma'am. I fear denial and afraid if I'm going to fail. Currently in hospice and I love it. I'm just so scared. Hey, if you're scared, go to church. That's one thing I'll tell you. And the other thing I'm telling you, you're going to be scared regardless. You're going to be scared regardless, but you're going to do it anyway. I like to call that getting off the beach. Get off your beach. You stay on the beach, you're never going to progress. You stay on the beach, you're going to die. That's a World War II, esque type of thing that I like to say during like when they invaded Normandy, France. You stay on the beach, you're going to die if you don't get off the beach. You got to be scared and you got to mosey your way through it. I fear denial. Well, if you fear denial, how do you make it through life? Because you're going to get denied every step of the way. All greatness gets denied or gets delayed. I don't even say denial because you could ask 1,000,000 times. Guess what? 1,000,001 could get you that answer. What's up, Karam? How are you? It's lucrative except in Tennessee. Depends on what you do in Tennessee. Just finished nursing school last Friday for LPN. This is my last semester. For me, was exhausting. Hey, nursing school is endurance. That's what a lot of people don't realize. Nursing school is endurance. Hey, if you guys are just now joining, keep smashing that like button. Hey, give me the 10,000 likes. Your boy could be happy. You know what I'm saying? But hey, we're talking nursing, talk NCLEX, talk whatever. I want to know who you are, where you're from, where you're at in your nursing journey. What questions do you guys have? And of course, if I can't answer those questions, you got some wonderful people down here in the chat that can answer your questions as well. Really afraid I won't pass. Okay. Words confuse me. I have test anxiety. So here's the thing. You're afraid that you won't pass. So I failed NCLEX 3 times, y'all. I failed so many tests in nursing school. It's ridiculous. I failed my entrance exam, HESI, 1 time. No one cares. Frenchie, you have to get out of your own way because the only person that will deny you progression is you. So you're afraid. Guess what? You're going to be afraid. You're going to push through it. The words confuse you. Okay, so if the words confuse you, take extra time to understand those medical terminologies or those other things that you have confusion on, right? And test anxiety. The way to get over test anxiety that I have seen over the last number of years, to include myself, is that you have to recreate the testing environment. Recreate the testing environment to where, or any environment that's going to be like crazy like that, recreate it the best way possible. And then when you do it, you practice like you play. That way, when you go and sit for that exam, it's not going to be a surprise to you. It's just like when I took my NCLEX, I ended up sitting like this. And then I got to question 40 and I looked at my hand. I was like, oh, now I'm in a position of comfort because that's how I practiced. So I didn't have test anxiety when I took it the last time. You see what I'm saying? That's what you have to do. Great advice. It's okay to fail. It is okay to fail. Is NCLEX harder than nursing school? No. Nursing school is 10 times harder than the NCLEX was. It's a high demand job and has convenient schedules plus a rewarding job. Yep. Nursing is a very flexible field. You can work in many areas. You sure can. Congratulations to all nurses and new nurses and nurses progression. I wish you the very best. Fire Mom, appreciate you. After losing my mom, I knew I wanted to make a difference in people's lives. And that's what it takes. Guys, remember, employers don't give a shit about how many tries it took. Do you have a license or not? Facts. Let them know. Let them know, registered nurse dude, retired nurse, 35 years. And if you are there for money, it will show. It will most definitely show. It will most definitely show. However, money does make the world go round. And that's the thing. That's the issue that's happening right now. Even seasoned nurses, to where they get paid, you get underpaid and drastically overworked with nothing to show for it on your end. Got to see in stats. Should I take that course? No. Why? What's the 7-day NCLEX course, the 7-day course based off of? So it's based off of, first thing, it's based off of how when you go and take an NCLEX course or an NCLEX review for any of these bigger people that are out there, they do it over the span of like 3 days or of a weekend, and they cram all this information into you. I said, let's do it on demand and let's do it over 7 days. All I ask is an hour to 3 hours of your time throughout the day for you to go through questions and answers with me, to include there's some other content and all kinds of other stuff that's going to be there for you. That's what it's based off of. It's based off of giving you time to absorb the material versus me trying to cram all this Everybody always just like, I don't have enough time. I'm going to lose this job. Let me tell you something right now. Nurses are drastically undermanned, woman, person, whatever. So trust and believe me when I tell you, there's always going to be a job opportunity out there for you. Juan says, I graduated nursing school with bad grades and I'm worried about the NCLEX. Nah, don't worry about that. So if you just said it, I graduated nursing school with bad grades. Stop. I graduated nursing school. So now how am I going to, now you got to prepare for the NCLEX. Just like that. I just completed RN-BSN school today. NCLEX Nest, let's go. That's what I'm talking about. I have to retake my T's. I can only imagine the NCLEX. So the T's is nothing compared to the NCLEX. It's nothing. They're like night and day. It says, good night, Kevin, logging in Tobago. Shout out to you. Have a good evening. LPN here. Started my RN program in January. Yes. I have a problem with process of elimination. Sometimes 2 answers seem correct. That's because 2 answers are correct. Which one is more correct? That's what the NCLEX wants. Spend more time. Aaliyah from Charlotte. Shout out to Leah. Last semester of nursing school coming up. Any advice for MedSurg 2? Get into a small group of people, Aaliyah. You, 3 other people, if you haven't done this, split it up. 25% of the work can reap you 100% of the benefits. Going into my last semester of nursing school. So excited to be done and starting to work as a nurse. Yep, I know that's right. Kevin is giving the best advice. Hey, Fire Mom, that's what I like to do. I appreciate your nice words. Any tips for farm and MedSurg 1, please? So for farm, you got to know your family name, your umbrella of where they fall under, family name, suffixes, your prefix, your suffix. Once you understand that all LOLs are beta blockers and all beta blockers are LOLs, you will understand, like, okay, now I know they fall under cardiac meds. I need to know what they do. Are they inotropic, chronotropic, drono? There you go. Once you understand like what they do to the heart, does it contract? Does it strengthen the heart? Does it relax the heart? Constrict, relax blood vessels? And then I need to know vital signs. Right? Cardiac meds is huge for vital signs. Do I hold it? Do I give it? So on and so forth. And then you got to think of safety implications, orthostatic hypotension, stuff like that. So it says, reread the question and ask yourself, if I choose this or not, will my patient be alive? Yeah. So what if I delay it, will my patient die? Or who's going to die if I don't take care of them first? Traveling LPN or future traveling LPN. That's what I'm talking about. I need that. It's a 7-day 101. The 7-day NCLEX course is not 101. It's an on-demand course. But if you are looking to do something 101, I do offer 101 tutoring. That link is in my bio. A lot of people ask me about price, but the prices differ depending on what you need. So I don't really talk about the price, but you can go to the website and the website will tell you everything that 101ing actually consists of. What are your thoughts on MedSurg? MedSurg is chocolate. MedSurg is a specialty. All right. I need people to realize that. People are at school, they make it seem like everybody needs to go to MedSurg, but MedSurg is a specialty. But just because it's a specialty doesn't mean you have to go there. I went straight to critical care. Other people do the same thing. You can do the same thing as well. Those days are over. This isn't the 1980s. You know what I'm saying? Where they force you to go there. Those days are over. You can go wherever you want. Within reason, there are certain places where you can't go unless you have certain nursing experience. Would you consider a PhD in nursing? PhD, DMP, Doctorate of Education. I would consider all of them. But I'm going to get my master's right now. I do midwifery in Ghana and currently am a permanent green card holder. Please, can I also write? I'm assuming you mean, can you actually also take the NCLEX? Yeah, you can take the NCLEX. You just have to know what you just have to go and see what the equivalent is from Ghana through the National Council and also your state and what is all linked up together. Hello, do I need to get BSN or ASN? Is just fine. You can stay in ASN, but when you get to wherever you're going, they're going to be like, hey, they're going to want you to get your bachelor's. But let me tell you, I've met nurse managers who have associate's degrees and they're phenomenal. So future RN24, good evening. How are you? I'm doing well. Any tips for the exit HESI? So Chantel, I thought I could have swore I've told you that before. I'm not sure. But anyway, sorry, y'all. My eyes are all like puffy and crusty because the freaking allergies here in Texas are crazy. So, but the tips for the exit HESI is essentially accumulation, like management of care, delegation, assignment, pharmacology, who do you see first type. Definitely you want to stay with what I like to call the big 3, management of care. So delegation, assignment. You definitely need to know your pharmacology. You definitely need to know like, hey, what's happening if somebody has acute or chronic type of issues, what's expected, not expected, so on and so forth. I need advice for upcoming critical care and leadership. I'm terrified, Kevin. Ma'am. So critical care, who's going to die? Who's going to die if you don't see them first? Think about it like that. right? And then you have to understand what are expected outcomes, what are unexpected outcomes. So if I have somebody who has COPD with an O2 saturation of 89, is that expected or unexpected? Well, I would expect that because people with COPD have a fluctuating O2 saturation factor, right? So, but I would not expect somebody with COPD to have abdominal distension that is, painful to the touch, it's rigid, and it looks like it has bruising. Does that make sense? So it's all about practice. I passed NCLEX. Nina Beauty, you said you passed NCLEX? Did I understand that right? Let me make sure I understand. What was the passing grade needed for NCLEX? So NCLEX is not a passing grade. Essentially, it's just a pass or fail. Now, when you're studying, we do it pretty much off of a scale, and you want to have above a 50%. But the NCLEX is what we call computer adaptive, and it all is based off of you and how you do and how you answer. You answer correctly, they're going to give you a harder question. You answer incorrectly, they're going to give you a slightly easier question, and then it fluctuates all the way like that. It says, can you talk about the MIC, I don't know what that is. You talking about MECEP? Moon? Is that what you're talking about? MECEP? I don't know exactly what you're talking about. But Megan, your jacket. So, yes, for critical care and leadership, you need to understand, that's the same exact thing is like, who do you see first? So if I'm an ER nurse and I'm going to give you report and I'm giving you these 4 individuals, who do you see first? Like, who are you going to see first? Right? Based off of what's going to happen, right? But this is where you need to this is where like patho comes into play. This is where you understanding your disease processes. And then of course, your ABCs, level of consciousness, right? So what's an expected outcome for somebody who has, acute asthma, right? Or what is an expected outcome for somebody with COPD? Or what's an expected outcome for somebody who has congestive heart failure? Right. And so if it's an expected outcome, obviously I'm not going to see them first. But if they have a chronic illness, but then there's something that is not expected that probably warrants that I pay attention to them first. OK, so think about it along those lines as well. What do you think about the CRNA field? I think it's great. I actually wanted to go the CRNA route for quite some time. And then I was just like, nah, I don't want to. CRNA it was a dream that I had 10 years ago. And as I furthered into my nursing journey, I realized that CRNA just wasn't my thing anymore. And I'm okay with that. But CRNA is great. They're the highest paid nurses in the nursing profession. So and very much so based off of what they do and their level of responsibility. But Moon was talking about the MECEP program. So if you're talking about the Medical Enlisted Commissioning Program, that is a program that is specifically for the Navy and the Marine Corps. To where you can go from being any rate or any job in the United States Navy as an enlisted person or an enlistment or whatever, to where you can apply to become a nurse corps officer. They will pay for you to go to school, get your bachelor's degree, and then once you finish and get your degree, you commission as a nurse corps officer in the United States Navy. So that's essentially what the MECEP program is, and it's MECP, so Medical Enlisted Commissioning Program. Megan says, I have 2 quarters left of my BSN. Should I do a CAT exam on ATI? You have 2 quarters. How long are your quarters? See people say quarters and semesters, so I always get confused with quarters because that's not something normally that I would be a part of. What program did you use to prepare for the NCLEX? Do you recommend Archer? So Sylvia, let me tell you something. I spent a total of almost $3,000 on different programs and retaking my NCLEX. So I've used UWorld, I've used Archer, I've used Hearst, I've used Mark Klimic, I used Board Vitals, I used Saunders. I personally did not like UWorld. That's just me though. But UWorld the proof is in the pudding because it's been around for so long. But personally for me, it all just depends on you. It really all just depends on you and what type of learner that you are, how well you absorb and retain material. Some people swear by UWorld, but I'd be like, hey, I don't like UWorld, but that's just me. Whatever you want to do in the end is whatever you want to do. You know what I'm saying? So, but Archer is great. I actually like Archer's questions. Like when I do one-on-one tutorings with my coaching students right now, I use Archer. I essentially use whatever they have. If they have Archer, if they have UWorld, they have Kaplan, Hearst, whatever, I can coach them to whatever. But Archer, most definitely, I would recommend. I think they're pretty great. 11 weeks. Okay. So 11 weeks. So what, you graduate at the end of the summer next year, Megan? How much is the NCLEX? The NCLEX depends on your state. So when you get right out of school, you don't really necessarily have to pay for it except for when you have to pay Pearson VUE. Now, certain places where you, like California, I heard it's like $495 to take that exam. In Texas, it's up to $300 based off of you pay $100 to the Board of Nursing and then $200 to Pearson VUE. So it's all state dependent. I'm using Mark Klimic, but was thinking of trying Archer. Use both. Mark Klimic is really good for honing in on the reviewing aspect of trying to remember specific things that are important. In the Archer, they give you questions and content. There's some other ones that are in there that they give too. About to start my ABSN program at Miami next month. Shout out to you, Austin. I'm set to graduate June of 24. My ATI Pulse report says a 97% chance of passing NCLEX. You're Gucci then. You're Gucci. The closer, here's the thing, Megan, the closer that you start getting to your last semester, you really don't need to start studying heavy for NCLEX until you are in your last semester. Sylvia, you're welcome. I start my NUS courses coming spring. I'm so anxious and don't know what to expect. Sherry, so here's one thing I will tell you, to get your time management down now. Like, so if you got a family, you better let them know that your life is about to be school and then them. That's kind of funky to say, but it's sort of true. Nursing school is about to take over your life. So you got to be very understanding of that, and then be ready to get humbled, and then be ready to be working. Right. That's why I always try to tell people, find a group of people. And by a group, I mean you and 3 other people, and stick with that group to where you guys can start splitting up work together. And that way, 25% of the work, get you 100% of the benefits. I'm just saying. What's the difference between an ASN and a BSN? ASN, associate's degree nurse is 2-year degree, BSN 4-year degree. So it's more of the education aspect of what you're learning, research, so on and so forth. That's what separates the BSN from the ASN. Is it better to do ASN than to get a BSN? Is it Nefertiti? I feel like, that's an Egyptian name. Only reason I know that, I hope I'm right, but I heard it off the mummy. Okay, don't come for me. All right. Sometimes I'm uncultured and sometimes I'm not. You know what I'm saying? But to answer your question, there are very successful nurses that are out there that have a 2-year degree. You know what I'm saying? It's this whole nursing dynamic that, hey, that I'm better than you because I have this. That's not necessarily true. So, but if you want to work your way through the clinical ladder, you want to get your associate's degree, then get your bachelor's, your master's, doctorate, so on and so forth. I've been out of the nursing for 2 years. Any suggestions for me? I'm scared of NCLEX. Hey, if you're scared, go to church, number 1. Number 2, you're going to do it scared anyway. So my suggestion for you for being out of nursing school and getting ready is to start where your most difficult area is. And then, so if it's pharmacology, start studying pharmacology content, incorporating Q&A, doing your rationales, and then, going back and forth. But if you've been out of school for 2 years and you want somebody to guide you, I tutor, and you can check that out. That link is in my bio. To where I tutor people. So I actually just coached a young lady. She's not a young lady. She's older than me. She's like in her 50s. And she took her NCLEX. She failed NCLEX RN 11 times, y'all. 1 more than 10, 1 less than 12. She took her NCLEX on the 21st, working with me and me helping her, right? She did all the work. I guided her, y'all, and she passed her NCLEX on her 12th time. You want to know who's not going to give a shit about that? A job. If you guys are finding this shit valuable at all, just smash that like. Hey, give me the 10,000 likes. Get carpal tunnel for me. Okay? But, I'm trying to tell y'all, guidance and mentorship works. So especially for those that have been out of school for a while, if that's what you need, I got you. I'm an LPN in urgent care thinking about ED after I finish my bridge program. Thoughts? Amanda, if that's where you want to go, then go. If ER is where you want to go, definitely go there. It's controlled chaos. Sherry says you're welcome. Oh, thank you. You're welcome. I'm sorry. Is Remar nursing good for NCLEX review? I think Remar is okay. I don't put it this way. I'm not. If I think that a review isn't good, I will tell you. Or I won't even mention it. I won't mention it at all. I'll be like, I don't know nothing about them because I don't. Or if I know if it's not good, I'll ignore the question or whatever. I'll be like, I don't know anything about them. But Remar, Regina Callion, I think her stuff is okay. I just think it's okay. I reviewed her stuff like a long time ago. But I know she's changed some stuff up here recently. What does it say? I'm not feeling confident with it though. I wasn't this worried at the beginning of you weren't this worried about your program because you didn't realize how important the NCLEX was. That's why. And then the closer that you get to graduation, you really understand that, hey, I need to be trying to get my license and stuff together. That's why it's not important. However, it shouldn't be important at the beginning of nursing school because you don't even know what you don't know until you get to where you need to be, if that makes sense, right? So it's okay for you to feel that way, right? But the best way to get over that hump of feeling anxious and being more confident is to practice. But you have time. In reality, nobody needs more than 90 days to study for this exam. If I can coach somebody for 30 days and mentor somebody for 30 days and get them to pass their NCLEX on the next attempt, there should be no reason. There should be no reason why you need more than 90 days to study for this exam. How did you do college while active duty? I went to school online and I had a really good chain of command that was understanding. Hey, here's the thing. If anybody's in the military and wants to think about doing nursing, number one, you need to realize is that the mission always comes first. It doesn't matter where you are, where your duty station is. The mission always comes first. If the mission is always taken care of, they don't have a problem letting you do other things to help you, succeed personally. But if it interferes with the mission, you might as well just kick that shit goodbye. So that's what I'm saying. It says, yes, you were right on the Egyptian facts. Oh, okay. Nefertiti. Got you. Austin, I got my degree in biology a few years back, which is why I'm going for my, oh, okay. Shout out to you, Austin. Nefertiti, you're welcome. Yes, Lord. Wow. Do you help nursing students? I do help nursing students. Do you coach for LPN? Absolutely. Bree, I actually, if you go to my YouTube channel or if you go to the link, if you go into my bio, there's one that I just posted probably like a week ago. It says how to pass NCLEX in 30 days. And it was with a young lady named Helen. And she just got her LPN. She got her LPN November 6th. And she worked with me the whole month of October. Went in there, killed it. And now she's an LPN doing her thing. So I definitely help LPNs as well as RNs. My school has a success in nursing school classes. I'm halfway done with it. I start school on the 8th. Shout out to you. What are your thoughts on, is it Rasmussen University? I don't know. I've never heard of it. Let me know. Tell me about it. I finished LPN back in July and I still have to take my NCLEX. I'm scared to take it. Hey, put it this way. If you're scared and you don't make progression, that's your own fucking fault. I'm telling you right now. And I'm saying this with so much love and respect to y'all. If you're gonna be scared, do it anyway. Be scared and do it anyway. Get off your own beach. Get out of your own way. Right? You're not going to progress anywhere. I'm not even talking about the NCLEX. You're not going to progress anywhere if your ass doesn't get off the beach. If you don't do it scared, you're not going to make it. So be scared. That's okay. But do it anyway. All right. How long should you study before taking your NCLEX? So Catherine, that's kind of a weighted question because I don't know. Are you coming out of school? Have you not, what's the word I'm looking for? Did you graduate a couple of years ago? Have you failed once? So it all just depends, and it's all about time management, right? Study calendars, trackers, all these other, that's why I said things are different for people, but I always say a rule of thumb, you don't need more than 30, you don't need nothing less than 30 days on average, right? Nothing less than 30 days, but nothing more than 90 days. I've coached people and mentored people right out of school where they worked with me for 2 weeks straight, passed. Or people that graduated, they worked with me for a month straight, passed. 45 days, passed. Nothing longer than 90 days in reality. Any tips for those using Kaplan? Is it Britia? So I used Kaplan. I love Kaplan. As a matter of fact, if you go to my YouTube channel all the way back to 2020, I actually did a Kaplan review. The tips to using Kaplan is follow the phases. Follow the phases. I got nurse REMAR, but I would love to do private sessions before the exam. I will look into it. Okay, Aquarius, but yeah, check that out. It's up there. The link is in my bio. It's either the private one-on-one tutoring, or if you're looking for a packaged type of thing, you can check out the NCLEX coaching and mentoring, where we talk about a bunch of stuff. This is my last semester. What's a good program to use for NCLEX? So that all just depends. Nurse C. So I have an NCLEX course, the 7-day NCLEX course. You can check that up in my bio. You get it for a lifetime, but then they have other ones that are out there like, Archer, UWorld, Kaplan, Hearst, all those other ones. But of course, I'm always going to recommend mine first. It's very content heavy, where I go over the new generation NCLEX review. I have a new generation NCLEX review, and then I'm developing and consistently putting in more sections from the 8 sections of the NCLEX client needs for that review as well. So that's my answer I would give you. How has been your experience as a male nurse? Oh, I think so. The thing about a male nurse is people don't really bother you. I like the nurses love male nurses because in reality, there's things that we can do that they can't, such as, we can lift heavier patients and help them move, so on and so forth. Most guys that are in there are very like take charge, and a lot of the female nurses like that. That's not saying anything bad about the female nurses, but they just like, we're glad that they love to see men in nursing. So my experience has been overall great. I have had some experiences where I've had nurses be rude or disrespectful to me, and then I check them, and then when I check them, they're just like, oh my God, I can't believe you did that. Getting all emotional in their own fucking feelings, and that's their own fucking fault. But but the majority of the time, the experience has been good. I think I'm scared because a lot of my friends have failed the NCLEX. What do your friends have to do with you, Bree? Your friends have nothing to do with you. This right here, that's my degree. It doesn't say Kevin and friends. You see what I'm saying? Like, that's something else. But this right here does not say Kevin and friends. So I've had friends that failed out of school. It doesn't say Kevin and friends passed together. It doesn't say that shit, right? So you're afraid of somebody else's perceptions of whatever they have going on. You have no idea what's going on with them. So once again, pull it back in. This is about you, and you are responsible for what you do and what you don't do. That's called accountability. And I'm a want for you to have some. Okay. So you need to get off your own beach. You can, don't tell me I think I'm scared. It's either you are or you aren't. There is no in between. You know what I mean? What do you recommend to study for NCLEX? Catherine, didn't I just say that? I think I just said that. What were your thoughts about Nexus Nursing? Would you recommend them? Nexus Nursing, I personally have never used them. I think I've seen them on YouTube, and I think their content was okay. Period. There you go. Amen. Amen. Hey, shout out to all 60 of you guys in here rocking with me. Hey, if you guys are just joining, I usually do questions, right? So since I usually do questions, we're not doing questions today. We're doing more of a reflection. It says, drink some water, lips dry as fuck. Sarah, don't be mean like that. Don't be mean like that, Sarah. She is good. Oh, Lord, No, you didn't miss the live. You didn't miss the live. It says, drink some water, lips dry as fuck. I actually did drink some water, and they're not dry, actually. I actually put some like chapstick on there. But don't be rude like that, Sarah, because I don't know if you're new here, but I fucking ban people that are fucking stupid. So don't do that. All right. I'm using ATI for my NCLEX after failing 3 times. So that's cool. If ATI works for you, cool, it works for you. If it doesn't, then it doesn't, So you just got to find out what type of study material works for you. All right. And like I said, I understand what it's like. I failed my NCLEX 3 times, 75 questions, 265 questions, 106 questions. And then I finally passed on 60 questions during COVID. So I understand. I've spent a total of $3,000 before I got my freaking license. You know what I mean? And then now I try to come here to help y'all avoid that. You know what I mean? Dry ass lips and all. So what I'm trying to tell y'all is you got to find those things. I personally have never used ATI. I never used ATI. My school had HESI. You know what I mean? Like my school has HESI. And so since my school had HESI, I don't know what it's like to use ATI. But I can tell you right now, I didn't like HESI. I didn't like Board Vitals. I didn't like Hearst. I didn't like Hearst because it was more of an environmental distraction to me. I loved Mark Klimek because it helped me with the audios. There was just a lot of things, family issues. I didn't have an accountability. Time management was terrible. It's just a whole umbrella of things that it comes into taking your NCLEX. And a lot of people, they were just like, oh, I need to pass. And I was like, well, we need to figure out what the source of your issue is before you start coming to me for stuff like that. How soon do you recommend to start studying for the NCLEX? I'm about to start my last semester. Ma'am, I specifically remember telling you this question, right? Or telling you this answer. So you're in your last semester of school. You're going to graduate probably in May. So in reality, you should start studying for NCLEX anywhere from like a month and a half before you graduate. Okay. And the reason being is because you're going to start studying for that month and a half. So you got a month and a half plus the month that you graduate, that puts you at 2.5 months. Right. And then you're going to get your authorization to test. That usually takes 2 to 4 weeks for you to get. You get the very first one. That puts you essentially like a good 3 months of studying. And then you go and take it. All right. You want to take your NCLEX as fast as possible, by the way. OK, so you definitely want to start studying about a month before you graduate. So a month before you graduate, that puts you at about a good 2 months. So anywhere from 2 to 3 months before you graduate. All right. So shout out to everybody that's in here rocking with me. Appreciate all the likes. Appreciate all the follows. What questions do you guys have? If you guys are just new here, my name is Kevin. I've been a nurse for 3.5 years. I have been in the Navy for 16 years. I've been an instructor for 8 of those years. A master instructor in the Navy. I've taught ACLS, ABLS, pre-hospital trauma, a whole bunch of other stuff. And so teaching is like my thing. I enjoy it. What's up, Thunder? Thunder, I ain't seen you in a long time. How you been? It says Hustleman D, best way to start prepping for farm and how to study for it. So, like I said, you weren't here earlier when I said this, but you want to know family name and suffixes. You need to know the umbrella of where your drugs follow. Like, so if I start talking about antivirals, you need to tell me which ones are antivirals. If I start talking about cardiac meds, you need to start telling me what cardiac meds fall under there. Like ACE inhibitors, ARBs, beta blockers, calcium channel blockers, all those good things. And then you need to let me know what are the, which ones. So we start talking about beta blockers. What are they? Like, what are the drug names? You know what I'm saying? Like, what are the drug names? So LOLs, beta blockers, LOLs. Okay. Like, do they strengthen the heart? Do they relax the heart? Do they strengthen the blood vessels? Constrict or dilate the blood vessels. Then, we're going to think about expected outcomes. Everything that NCLEX wants you to do, it revolves around getting the question, analyzing what they're saying, right? Applying your critical thinking to make a clinical judgment. That's what NCLEX wants. Okay, bet. Thanks. I got you, bro. I got you. It says, I failed nursing school by 1 point. I have to start over. Hey, you know what's funny? You just told me that you have to start over. You didn't say, hey, I failed nursing school by 1 point and I can never, ever go to nursing school again. That's called, what you just told me right there in that statement is called delayed, not denied. So guess what? Now you got to go all over again. But you want to know the cool thing about going all over again is that you done already seen it. So now you go through it now, it's going to be flying colors. Hey, Kevin, do you have like study guides for PN NCLEX? So here's the thing about the LPN NCLEX or the PN NCLEX versus the RN. It's all about what you can and can't do and what you can and cannot accept when it comes to being an LPN. That is it. You need to know that you don't assign. Like, RNs do not assign what we eat. I mean, we do not you can't assign what you can't eat, right? We don't do that for other individuals. LPNs, you accept orders from them, right? You can do sterile procedures like Foley's and wound care and stuff like that. But you can't do IV medications. You can't do first assessments, but you can do assessments to the point to collect data to give it to the RN. You know what I mean? So my 7-day NCLEX course, it also covers all that content for both RNs and LPNs. RNs and LPNs learn the same content. It's all about what level you can and can't do and what you can and can't accept. LPNs can't take unstable patients. Only RNs can do that. If you have a stable patient and they become unstable, guess whose patient that belongs to now? RN, right? It's like, you got some good memory. Okay, I got you. Propanolol, yep. Nurse practitioner here. I remember the NCLEX like it was yesterday. Be confident you got this. Let them know. You're welcome, Miss Black Queen. Hey, so what other questions do you guys have? I usually hang out here for about, I'm on here for about 2 hours, but, however long you guys want this chat to go is however long we'll go. You know what I'm saying? So, what else? But yeah, I failed my NCLEX 3 times, John, and nobody cares. Nobody ever asked me when I started working as a nurse how many times I failed my exam. Nobody. The biggest thing, a lot of people are asking me, like, what is the biggest thing that helped me passing NCLEX on the last time? Is honestly, it was about the fact that I got a mentor and I had a mentor check me and tell me what I wasn't doing. I knew what I wasn't doing, but it took somebody who was outside of me to let me know, hey, you're fucking up and I'm gonna need for you to fix yourself. I mean, it's essentially that's kind of how he said it. So, and I was like, you're right. And so I had to take accountability. I had to cut people off. I had to schedule my time. I had to schedule my study schedule. I had to do all kinds of stuff. And once I started to fix that, I started to see improvement. Like, it was like night and day. It was like I was a totally different person than I was who studied for the last exam or even the first exam. You know what I mean? Tips for new grads on the floor. Zay, what I would tell you is find a mentor. Find a good mentor on your floor that does not mind teaching you. The one thing that upsets me is when you start working on the floor, all those nurses that say, I don't want a student are, to me, they suck. Who are you to tell me that you don't want a student? Like, you forgot that you used to be a student a whole year and a half ago. You know what I mean? So find a good mentor, be a sponge, and then ask tons of questions. That's exactly what I would tell you. Starting second semester of the course, should I do NCLEX PN? I don't know. Miranda. I don't know exactly what you mean. You start your second semester of course, should I do the PN? I don't know what that means. You got to elaborate. Shafonda says I failed 3 times. Same. Me too. Not sure if you already went over this. What's the best way to study farm? That is, I literally, by Felicia, I literally went over that already. However, I will say it for you again. You need to understand where medications fall under when it comes to the umbrella. So if I start talking about antivirals, antidiuretics, if I start talking about, or diuretics, not antidiuretics, anti-diabetics or diuretics or cardiac meds or GI meds, respiratory meds. You need to know what medications fall under there. So I'll give you an example. We'll talk about cardiac meds. Cardiac meds, right? Cardiac meds, your ARBs, your ACE inhibitors, beta blockers, calcium channel blockers, right? What else? The calcium channel blockers, digoxin, right? And then your anti-arrhythmic medications, lidocaine, amiodarone, procanamide, right? Stuff like that. You need to understand where they fall under. I know all those fall under cardiac. I know that all beta blockers are LOLs. I know that the beta blockers relax the blood vessels to lower the blood pressure, right? So I do also understand that the expected outcome is to lower the blood pressure, not to increase the blood pressure. I know that if the blood pressure is too low, I should hold the medications. And I also should know that somebody getting a beta blocker has orthostatic hypotension, nitroglycerin too. Yep. So you got to think of that's how you have to apply your critical thinking in order to make a clinical judgment. I'm struggling with dosage calculations. Do you have any tips? Practice. Honestly, with dosage calculations, it's practice, practice, practice. There's no other way that I can really tell you about that. Like, it's just practice. Celeste says mentor is a Navy concept or a military concept. We are used to working in teams. Civvies don't. Look, I don't give a shit about what any civilian tells me about whatever. Get you a mentor. It could be a Navy concept or a military concept, but it's still relatively the same. Working as a team. Just because you have a mentor doesn't mean you still don't have the team concept. Mentor doesn't mean like, hey, it's a end all be all. You're the only person that gives me it. No. That's not how that works. That's not how that works. But bringing in a military concept into civilians can actually show people different. You got to think. Most thing I've noticed is that most civilians are selfish, and military, it's very team-esque concepts. Because of like what our whole ethos and our environments are in the military. That's just me personally for what I have experienced. So if I can bring the term mentor in there, look, Celeste, we already know what the deal is. You know I'm bringing it. I'm bringing the heat. I take mental health next. How to prepare. I don't have my syllabus as of yet. Mental health is all about good therapeutic communication skills as well as expected outcomes of like antipsychotic medications. So I would definitely start there. Is it Crystal Israel? I asked my charge nurse to be my mentor when I became an RN. She's the most experienced in IC 20 years. And look at that. And how did that work out for you, Crystal, like the champagne? Thank you so much for going over. Felicia, you are welcome. Miranda says, is it worth it getting my LPN even though I plan to finish with the ADN? So I see what you're saying. Miranda. You are in your second of your program, but now you are eligible to take the LPN. So a lot of people will get their LPN just in case they don't make it to get their RN, right? But in my opinion, you're in an RN program. And unless you really want to get out there and start working as an LPN, then I would just go all the way, get your RN and just keep it pushing. What did you say about mental health again? Layla, ma'am, I'm gonna need for you to keep up. All right. No, but for mental health, antipsychotic medications, like the effects, the durations, how long it takes for those to kick in, as well as good therapeutic communication. That's what that's about. I took my NCLEX PN yesterday for the 3rd time, hoping I passed. Hey, how about we change that, V, baby? We've talked about this, right? How about we change that? You know what I'm saying? Took my NCLEX PN yesterday for the 3rd time. I passed. I don't want to hear that hoping. If you put in the work like I know you did, hey, look, you Gucci out there. Shout out to all 50 of you guys in here rocking with me and gals. We're just doing nursing, talking NCLEX, whatever questions do you guys have. I want to know who you are, where you're from, where you're at in your nursing journey. I've been licking my lips because somebody told me that my lips were dry when they're actually kind of moist. It might just be, how this light is going in my face. So if I'm licking my lips, just know I'm self-conscious about my lips. Okay. But yeah, I want to know who you are, where you're from, where you're at in your nurse journey. It worked great. ACC, she gave me references for a lead position in the ER, and so got it. Take initiative. Facts. Absolutely. I'm glad that worked out well for you. I really am, because I actually, when I got to my ICU, I told them, I was like, hey, I want to work with this person all the time, like as my preceptor, and they were just like, no, you need to go on nights, and I'm like, what the fuck? So, but she's still a great mentor to me, like to this day. And she's a cardiac nurse practitioner. One's a cardiac nurse practitioner, and the other one is a acute care nurse practitioner working specifically in pulmonary. So shout out to Amanda and shout out to Jenna. Jenna will pop in here every so often. So New Jersey, shout out to you for the LPN program, studying for my NCLEX PN. Go ahead, Gloria, Miss Gloria. Oh, you just finished your LPN program and you're studying for NCLEX. Oh, okay, tracking. Gotcha. All right, cool. What else we got? Layla says I'm LPN. That is enrolled in the LPN to RN Bridge program in Michigan. Shout out to you. So what other questions do you guys have? I'm going to hang out here for a little bit more. I do want to talk about how your year has gone. I really want everybody to think. I really want everybody to really think to themselves right now. Think about to yourself where you started January 1st of 2023. My allergies are acting up, Lisa RN. Yeah, my allergies are acting up really bad. So I really want you guys to just give yourself some perspective of where you guys started in January of this year. Because Monday, or whatever day it is, I'm not looking at a calendar right now, we're going to be into 2024. So the one thing I want you to do is I want you to realize your progression of where you were at the beginning of this year when you started your program, or if you graduated or got your license or whatever, where you started to where you are now. And then realize, hindsight's 2020, it could have been way worse. You're alive, you're here, you're listening to me talk to you, all that good stuff. But you progressed in some way, shape, or form. You were scared at the beginning, but you did it scared anyway, and look how you progressed. All right, so I really want everybody to think about that and understand like where you were and how far you've come in order to progress, in order to make it, further in not just this field, but in your life and what you're doing for yourself, as well as taking care of other people, right? It says hard, but I got through it. I know that's right. Alabama, starting the nursing program again, trying to stay ahead. That's all you can do. That's all you can do is stay ahead. Take control of what you have control over. All right. It says repeated a Pharm 1 in the beginning of the year. Graduation got pushed back, but now I'm done. Look at that. Your motivation is amazing. You should become an instructor. You'd be awesome. So So here's the thing. I've been an instructor in programs, not nursing programs specifically, but I was a clinical coordinator and instructor in a surgical technology program. I've taught ACLS. I've taught ABLS. I've taught pre-hospital trauma. I'm a master instructor in the Navy. And funny thing, I've actually applied at, nursing schools, and I applied at like 5 or 6 of them in August, and haven't heard nothing back. But I get told all the time, hey, they need instructors. I'm just like, all right, cool. If y'all need me, y'all know where to find me, right? But here I am still hollering at y'all, which I'm still totally okay with because I have total control over this, right? So, but yeah, I appreciate your nice words, Crystal. And I enjoy doing this. I enjoy teaching. Teaching is probably one of the best things I've ever done as in my adult life. Do you have a podcast platform, any other platform that are just as educational as your TikTok? So Zay, if you go to my Instagram is at the Boot Nurse, exactly kind of like this. If you go to my YouTube channel, every TikTok that I do ends up going on to YouTube. And I've been doing TikTok like this religiously, I think like since March or April. So very, very beneficial for those that need it. So if you need to go up there and check those out, you surely can. Like I said, I usually do Q&A, but I wanted to use today as a day of reflection. And then on next Wednesday, we're going to, just because I'm up here talking about motivation and motivating y'all doesn't mean that the work is finished. Some of y'all still got NCLEX to take next week. You know what I'm saying? Just because it's the holiday don't mean we stop working around here. That's not what we about. But yeah, Zay, you can go over there and check those out. But yeah, and also I have other educational stuff. Like I have a free download. If you guys go check my bio, it's test taking tips on how to conquer the NCLEX. 42 pages. You know, guys, go over there and check that out. Talk about, you know, like little like keywords to look out for, like when you guys are studying for NCLEX. What else? You know, common things that you'll see on NCLEX, dosage calculation stuff. There's all kinds of stuff that's over there that's super helpful. So you guys can go over there, and it's free to y'all. And then, of course, I had an ebook that's over there, the 7-day NCLEX course that's over there. And of course, if you need something more personal, we can you know, get on a phone call and talk about what you have going on privately. Those are also linked in my bio as well. Maddie, you're welcome. I can see your is that you doing peace? I can't tell, but yeah, you already know. You know what's up. It says, I will pass on your info to others I know could benefit from hearing your message. Hey, Crystal, I appreciate that. I really, really do. I really, really do. Because the more that you guys tell people about this, the more people that this is beneficial to. That's why I say, hey, if you're in nursing school right now and you don't share this to people in your cohort, you're fucking selfish. A lot of people try to gatekeep. I don't gatekeep. I'll flat out tell you. I gain nothing by gatekeeping from y'all. You know what I mean? It says learning to be grateful. What you mean? In good times and in the bad, take photos with loved ones and enjoy every second. I got you, Grace. I'm tracking. I won't be doing NCLEX, but I will be doing the RENR because I am from the Caribbean. Are they similar? I've never even heard of that. Is that like, what is R? Please educate me, because like I said, I don't sit up here and talk about like I know everything, but I'll give you all the information that I know and I'll give it to you with confidence. But RENR, I personally have not heard of. So please educate us. Let us know what that is. Is it Kai or Key? I'm not sure how to pronounce that. So, but yeah, take a look upon, learn from how your year was to going into your next year and not repeating it. A lot of people are just like, oh, my New Year's resolution. Yo, I'm tired of people waiting until January 1st. Like January 1st is the end all be all. Like if you're going to make a change, do that shit right now. If you're going to make a change in your life, do it right now. Do not wait until January 1st so you can go to the gym and then all of a sudden you're dedicated for a month, and then next you know this gym got your money, but your ass is sitting at home and you quit. You see what I'm saying? Make that make sense. Bell, educate me, Kevin. Bell, you and I, ma'am, have had massive amounts of educating. All right. And today is more of like motivation and trying to keep your eyes on the prize, you know, keep going forward. And ma'am, you and I have already had a talk. A regional examination for nurse registration. Huh. Okay. So essentially it's the licensing exam, but for the Caribbean. So I'm assuming based off of that, I'm actually going to do a little bit more research on that myself. But based off of that, I'm assuming that's what that is. It's assuming, so it allows, because, you know, you went through formal education in the Caribbean. You take that exam, it gives you a license so you can practice nursing in the Caribbean. So if that's what it allows for you to do, that's exactly what the NCLEX here in the United States and Canada allows for you to do as well. And it does allow for you to do that as well. Miss Gloria, thank you for the follow. I appreciate you. But what other questions do you guys have? By the way, if you guys are new here, my name is Kevin. I'm a nurse. I've worked in a burn ICU, a neuro ICU, and a medical ICU, and I've floated to med-surg a few times. I've worked in PACU as well as I've worked in the operating room. I want to know who you are, where you're from, where you're at in your nursing journey, what questions that you have. Yeah, and let's get it on and popping. I've been in the Navy, right there, been in the Navy for 16 years. And I've been on 2 deployments. I've learned a lot with my military career. My military career is based off of all of military medicine and everything from LPNY, surgical technology, so the surgical realm, as well as now it is the instructor educational realm, as well as some things with nursing. So, you know, I know it doesn't look it because a lot of people are just like, oh my God, you look so young, Kevin. And I'm like, all right, Cool. Relax. Right. So, yeah, got a plethora of knowledge. And of course, I won't sit here and tell you that I know everything, because I don't. And if I don't, I will tell you where to go look. So I want to know, like I said, who you are, where you're from, where you're at in your journey, and what questions do you guys have? I'm going to hang out here for a couple of more minutes. And I know today is Friday, so if you're here on this Friday rocking with me, I appreciate you. But hey, like I said, ain't nothing wrong with giving a little bit of advice to those that you know that will eventually replace you. And that's going to be y'all. You know, think about those nurses that have worked for 20, 30, 40 years that are now retiring. You are now replacing them. And there's more of us than there are of them. So all that knowledge is leaving. So you got to be ready for that. I didn't do that well in LPN school. Do you think that can affect me as far as for no? Bree, have we talked? Why do I feel like you and I have talked in our like we've talked in the DMs before? I feel like you and I have had a thorough conversation, because it seems to me like it seems like you have lots of anxiety about, those things that are out of your control. The only thing is like, no, we haven't talked. I'm new here. Okay, Bree, that makes sense. And I know Bree's just like, man, this dude's talking to me like he's like one of my instructors. Trust me, if I was talking to you like this as an instructor, best believe I care about you. But they don't want me talking to y'all like that. If I was to work in academia, I would get fired. HR would be like, bro, what the fuck? So here's what I'll tell you. Once again, nobody cares. Like, don't continue to make the statements or make the excuses on why you can't do anything. And I know that's not what it seems like you're doing, but you're like, oh, I didn't do well in LPN school. So do you think that I could do further in my education? Yeah, absolutely. You know how many tests I failed? You know how many times I failed NCLEX? Failure in anything breeds success as long as you keep going and as long as you learn from the mistakes that you've made in the past. You know what the definition of insanity is? Hey, tell me what the definition. I need y'all to put it down in the chat. Tell me what the definition of insanity is. Tell me right now. And so, Bree, if that's how you were living your life with the definition of insanity, then of course I would be like, you're not going to go anywhere, right? You have to be able to learn from the mistakes in order for you to progress. All right. Cherry Blossom says 100. That's what I'm talking about. You know what I'm saying? So you have to be able to know those things. You have to be able to, and you have to be able to know you. Nobody knows you better than you. And until you come to the realization that you are your own problem, then it's kind of like, what is it? Coming to terms with yourself, like understanding who you are. That way you can progress and do better. Right. So what's the term for the definition of insanity? Doing the same thing over and over and then expecting the same results. Of course, like you're 1,000% right. That's what I'm saying. Insanity is doing the same thing, expecting a different result. There you go. My man, Pierre. Pierre knows what's up. Me and Pierre have conversations all the time, right? And Pierre knows what's up. So that's the definition of insanity. Do the same thing over and over, but expecting the same result. If you don't change, you will not progress. Period. And that's a you thing. That starts with you. So Bree, that's what I would recommend you do. What's up, Kate? Kate, I see you coming in here. Every time I see you coming here, I got to shout you out. If y'all don't know who Kate is, Miss Medi Kate over there, she is a paramedic working somewhere. I think she said, Kate, I think you live in Georgia, right? But that's a plethora of knowledge in that young lady's brain up there. So anybody looking to do paramedic or, ER, she's doing a bridge program, all that good jazz, because I love me some Kevin. Kate, girl, stop it. But Kate's a good one over there, y'all. Kate's a good one over there. She reminds me of a couple of my junior sailors that I have. They're just kind of like around her age and real outspoken. So shout out to you, Kate. Then the GOAT NCLEX teacher. Hey, hot Cheetos. I kind of want some hot Cheetos right now, but shout out to you. I appreciate you. But that's the thing, man. It's like I love, like, my goals and my dreams and my ambitions are to be like at that level, like that Mark Klimick level. Like that dude is like up here, right? So hey, if I could be the NCLEX GOAT teacher, hey, if that's what people want to hail me as, I'm cool with that. So appreciate all the love, though. Appreciate all the love. Hot Cheeto Kevin is amazing. I'm gonna shout him out every time. That's what I'm talking. And you do every time I go to your lives. You're like, hey, what's up, Kevin? If you guys don't follow Kevin, he's a nurse and he's amazing. But what other questions do you guys have? I'm gonna hang out for a little bit more. Hopefully I was able to answer you guys' questions, usually like right when the live starts off. I know people are just like, Kevin, where are my NCLEX questions? That's all I want. That's the only reason I'm here. Well, I ain't got them for you today. We're doing something a little bit different. All right. Hey, think about your 2023. Think about all the mistakes that you made. Think about where you were. And think about how far you've come. And then also think about how you are going to improve upon this year. That's how you scale. That's how you grow. That's how you get better. You know what I'm saying? Is it ideal for me to apply for an RN job even though I haven't taken the NCLEX yet? Is it ideal? 100%. It's very common practice. It's very common practice that people apply for nursing jobs in contingency of taking their NCLEX exam. All right. So it is very ideal. Was it user 38? Yep. It says, making fun of me, bro. I plan to move to North Carolina. Want to apply for Duke. How cool is to say is like I work for Duke. Hey, so I have a buddy of mine who lives in North Carolina right now, and he actually just graduated. He graduated, I want to say, in August from their PA program. So it's in Wilmington, or is it Williamsburg? So I think that's something like in North Carolina, right? But yeah, that's where he's at, and he loves it up there. So, but yeah, I think that actually be pretty cool. Duke is a really good school. So they got the monies to back it all up. I heard if I apply, there is a what? There is a what, Kate? What else are we thinking? What other question? Medics, they'll pay for my PA. Okay. Hey, if they have that opportunity, because I know you and I were going back and forth talking about if you wanted to go to be an MP or if you wanted to be a PA. So if that's, if that is your area and forte of the direction that you want to go, then I would definitely go that way for sure. Whatever, I always try to tell people, whatever is in the best, benefits of you. And then, of course, whatever is the best benefit for your pocket. A lot of people ask me, should I go straight for my RN or should I go LPN? I'll be like, okay, tell me what your pockets are telling you, because LPN, it's a cheaper degree. It's cheaper to get your LPN. And then once you start working with your LPN, you're working at a hospital, have the hospital pay for you to get your RN, and have your hospital to pay or get your associate's degree, and then get your bachelor's, and then get your master's. They can do all that too. Become a midwife or an MP. I don't know. That depends on you. I don't want to be either. So I would tell you neither. Now, if you want to be a midwife, then I would say go be a midwife. Or if you want to be a nurse practitioner, I'll be like, cool, go be a nurse practitioner. But then I'm going to ask you, what type of nurse practitioner do you want to be? Do you want to be family? Do you want to be pulmonary, acute care, cardiac, oncology, pediatric, surgical? Like, you tell me. Look, there's a lot of things that I am, but no man is a mind reader. I know that women want us to be that, but that ain't it. Okay. So if you want to do the surgical MP, so best way, honestly, the best way for you to be a surgical MP that I have seen is get your NCLEX or get your RN, go work as an OR nurse, and then become an RN first assist, right? If you want to be an RN first assist. And then once you do the RN first assist, apply for a nurse practitioner program. And then when it comes to specialties, and here's why I say you want to go to the ORs, because if you want to do surgical, you work in the surgical realm with the doctors that will hire you to their group as a nurse practitioner, a surgical nurse practitioner. And then go to MP school, specialize in surgery, get your board certification as an MP, and then go work surgical. A mental health MP. Rosa, is that what you do, or that's what you want to do? Can you talk about CRNA? Bianca, what do you want to know about CRNA? Thank you for the clarity. You're welcome. For CRNA, don't they require just ICU experience? So it's actually kind of finicky, but the majority of them, yes, they require at least 1 year of critical care experience. Anything you have for me? Bianca, I got whatever you want, girl. Like, what you want? You asked me about CRNA, right? Isn't that what you just asked, right? So, Bianca, since you specifically asked, and I saw Kate, she was saying something about ICU experience. So the majority of all CRNA programs are now DNP programs, so doctorates of nurse practitioners. So they're 36 months. And they want you to have the critical care experience, aka ICU. Doesn't matter the ICU. It could be medical, surgical, pediatric. Doesn't matter, right? So as long as you have critical, because they want to know that you have the management aspect of taking care of patients. Now, I know Kate will be like, well, they manage them in the ER too. Yeah, but not at the longevity at, like days and weeks at a time that an ICU does. And that is what CRNA programs, that's why they do the critical care, saying, hey, we need for you to have at least a year. Oh, cardiovascular, cardiothoracic, so on and so forth, right? Or NICU, right? And then once you do that, you apply for the schools. There's tons of schools out there. Like I said, I think they're all 36 months now. It used to be a master's program, but now they're all doctoral level programs because they added research. But no, when you go to a CRNA school, you will not work. It is actual in the contract of the school that you can not work because the school is that demanding. So if you want to talk about loans, you're probably going to be taking them out. So you got to be ready for that. But then they also have different programs that you can apply, like the VA. Like the VA actually has a CRNA program. The military itself has CRNA programs. They're very competitive, very, very competitive, but I'm not saying that they're not doable. But for the most average person, you're going to end up taking out a loan. Unless what a lot of people would do, they would get ICU experience and then they start traveling and taking really high contract travel nurse jobs and they save up and then they would pay for CRNA school straight cash. I think that's one girl who did that. She did travel nursing for 5 years and then the school that she wanted to go to, I think it was like $250K for 3 years. She saved up a majority of all of her travel money and then she paid outright for CRNA school. So that's another route that you could do as well. And then, of course, they have all different type of programs as well. That's my plan. I live in Boston. Ew. I mean, no, that's cool. Bianca, do you say khakis? I'm sorry. I don't mean that. I don't mean that. I have a friend that lives. She lives in. Is it Taunton? Taunton. Kevin, do you plan to do MP? Kate, you already know I'm not going to MP. Stop it. I'm going to get my master's in education, and then I'll probably either end up getting my PhD or getting my doctorate in education or something along those lines. I know everybody's just like, you should go be MP, you be a good one. I'm like, nope. So that's not more my love. That's not where my love or my passion is. At least not anymore. So I was weighing heavy on some of those. It's like, you be so great at it. I think teaching suits you though. So that's the thing is like, even if I found a nurse educator's job, like that section, oh yeah, I would love it. I would love that because I love teaching. I love it's weird. Like I love setting up the classrooms. I love setting up all that stuff. I love doing the presentation. It's just because I'm a very like big people person. I like to interact. I like to shotgun people and be like, what you think? No, some people it's for some people's cup of tea. It's a cup of tea for people and other folks it's not. And that's okay. So, but yeah, that's kind of like where that's at as well. So, but Bianca, I hope that that answered your question about CRNA. I'm planning to move to North Carolina and boy, I am excited. So much more opportunities. That's good because you live in Georgia. I would think Georgia would have a lot of opportunities for paramedics, but honestly, it doesn't matter where you go as a paramedic. It's just like, it's like you're going to do a lot of that work and you're going to get the shitty end of the stick. Like you're going to work. Like I know you said you were working like 120 hours every 2 weeks. Like it's crazy. It's crazy. And, but it's a little bit different because I think you said you do stuff in the ER as well. So, balances, Bianca, what you talking about? Balances. I don't know. I don't know what that means. It says North Carolina has adopted for advanced practice. Oh, okay. Well, hey, as a matter of fact, hey, educate me more on that because obviously I don't follow the paramedic realm. So what does advanced practice paramedic mean? In case, the 48 folks in here that don't know, because, we're talking about nursing and now we're turning this into a paramedic thing because Kate is here. What's up? Taking NCLEX on January 21st, then moving to Arizona, working under compact license. Okay, shout out to you. So that's cool, Nathan. And that's a great thing about having a compact license is that you can do that. So for sure. So it's essentially going to equal to PAs under okay. Okay. That is different. How do you apply for a compact license? So it depends on what state that you're in. So like I live in Texas. Texas is automatic. So there's an agreement. It's called the Nursing Licensure Compact. And essentially what it's saying is that certain states all fit the same criteria. So if you got a nursing license in Texas and you move to Georgia, you aren't required to apply for a Georgia state license to start working there. Now, if you are going to move to be a permanent resident, you do. You have, I think, up to 60 days from the day that you move there or the day you start working to get your license switched over to that state. Now, you have those individuals that are not part of the NLC, like California, Oregon, Minnesota, I think Massachusetts, Vermont, Connecticut, a few of those that are not a part of it. So in order for you to work in that state, you have to apply for that state's license. Not saying that you have to take an NCLEX, but you have to apply for that state's license in order for you to work there. Hopefully that makes sense. But yeah, you don't have to apply for one. The only time you apply for a compact license is if you are coming from a place that does not have a compact licensure agreement in their state, like California, Oregon, and then you move to a place that does. NYC to Texas, actually. So, okay, I'm tracking. They also do community paramedicine, do home checks, prescribe meds, etc. Okay. Does NCLEX offer multi-state kind of like yeah. So that's what the compact is. Sounds like reciprocity. It's exactly what it is. Like reciprocity, like with concealed carry. So yeah. So that's exactly, but they don't call it reciprocity or reciprocal. They call it the nursing licensure compact. Yeah. So I think they just do that. So they're just like, wait a minute. So is my license concealed? I don't know. Some people, they're just take a narrative and they'll run with it. But yeah, so that's essentially the same concept. So shout out to you. That was actually a really good question. Really good question. Do most travel RNs do the compact in case I transition? So let's just say, for example, you get your license in North Carolina, which is part of the nurse licensure compact, right? If you are a travel nurse and your home of records is North Carolina, but let's just say you go to Texas for a travel nurse contract, you don't have to get Texas's license because you don't plan on seeking residency there. Like you're not moving because you're going to go back to North Carolina. That's why they always ask for your address for tax purposes, so on and so forth, right? But if you plan on moving, it's still going to be compact, but it's going to say Texas instead of North Carolina. Does that make sense? Hopefully that makes sense, Kate. Hopefully that makes sense. But shout out to all, 33 of you guys in here rocking with me. Sorry if my eyes look a little gross, like having there's like the cedar is high, allergies is bad here in San Antonio, just Texas, period. So if I'm looking like a little crazy, that's why. But hey, I'm still getting on here, doing my thing. So, ashy ass, dry ass lips and all. And I don't really feel like they're all that dry. They feel kind of normal, but whatever. Do they look dry? Y'all let me know. Okay, I'm self-conscious. Anyways, do you think I do good in an RN spot? Kate, I think that you would be a great nurse, but you would have to really check you're going to say it. You're going to have to check your ego at the door. And you want to know why? Is because you're going to bring a lot of paramedic thought processes into being a nurse. And you already know what it's like to be, you already see what the nurses do and go through in a hospital. And you have to check your ego at the door, because that's what I had to do when I came from Navy medicine to where I did a bunch of stuff. And then I came to a civilian hospital and they look at me like I'm crazy. They're like, oh, no, you can't do that. And I'm like, what you mean? What you mean I can't do that? So that's one of those things that you have to really pay attention to. Apply Vaseline, Bianca. I know you ain't talking shit. I know you ain't doing it. And I put on chapstick, so I'm not even dry. It's not my fault that these things is voluptuous and people pay for these motherfuckers, okay? And I was born with them. Don't start with me, all right? If y'all find value, just for that comment, Bianca, hey, give me the 10,000 likes. Get carpal tunnel for me right now. Do it. Trey says, nah, you good. My man Trey, what's up, bro? How are you, sir? It says late nights getting to you. No, it's not even that. Like, it's just the allergies that are doing it. Like, it doesn't matter. Like, I wash my face, I apply stuff. It's just, it's just taking its course. So I got to take meds and stuff like that. So it happens fucking like every fall, winter here. So it's like you can't get away from it. San Antonio is pretty bad for it too. So if you appreciate me, hey, if you appreciate me, get carpal tunnel for me right now. And then let me know. Let me know when you get carpal tunnel. All right? No, but you're very welcome. Hey, so if you guys are just now joining us, we're talking just nursing stuff. like nursing, NCLEX, pre-nursing, nursing school, essentially whatever you guys want to talk about. I just want to know who you guys are, where you're from, where you're at in your nursing journey. What questions do you guys have? I'm going to hang out here for about probably another 10 minutes or so. So my brother lives in San Antonio and he has bad sinus issues right now. Yeah, I'm trying to tell y'all, people think this is a game. And I actually just got over, recovered from being sick because of the whole sinus issue. Like it's crazy. It's crazy. Usually it's like a cedar fever or just cedar thing. So in Illinois, starting my car nursing classes on the 2nd. Your car, okay. Well, shout out to you, Sarah, for starting your nursing classes in your car, but whatever. Your core, yeah, I figured that's what you meant. I got you. So you're starting on the 2nd. Okay. Desi, I know what she meant. I can read between the lines. Come on, y'all. Y'all got to give me a little bit more credit than that. So, but what other questions do you guys have? A little bit about me. If you guys don't know, I have been in the Navy for 16 years. I've been a nurse for 3.5 years. I've worked ICU. I've worked OR. I've worked PACU. I truly enjoy being a nurse. I do love the joy of, helping, getting somebody from their worst and getting them out the door and walking. I enjoy that. But you want to know what I enjoy the most? Teaching other people to do better than I did or to help them avoid the experiences that I experienced. So let me see what else we got. Hi, Kevin. What is marking? Say the question. I don't even know what. I don't even understand that. I don't understand your question. Last semester nursing student in VA. Gross. I mean, shout out to Virginia. Good for you. Study tips on what? Desi, you got to give me something specific. Bree says, would you recommend travel? Hell to the no. I didn't even finish that sentence. No, I do not recommend travel nursing for a new grad. Absolutely not. If you want to know the quickest way to lose your license, that'll do it, right? If you want to know the quickest way to get embarrassed, that will do it. Y'all don't look at the dollar signs that these travel companies are placing in front of you. They are going to set you up for failure, and you don't want to do that. I recommend anybody, if you're going to be a travel nurse, you need at the bare minimum, you need at least a year. But you want a good solid foundation. Give yourself 2 years before you start traveling. All right. Best way to prep for HESI A2. So Bianca, there's a book. It's it's the Trivium book. There's 2 books, Trivium, and it's like the HESI A2. Let me see if I see it. I don't have it. Or maybe I do. I'll have to find it. But I always recommend it to people that are going to be taking the HESI A2. Or you can do the Mometrics book. You can get it. It's like off Amazon, $33. You can find it in those 2 books. I recommend for if you're taking HESI or if you're taking the ATIT's entrance exam. I feel like I could do it, Kevin. Kate, I most definitely know that you could do it. Study tips for nursing school. So here's the thing for nursing school. It says RI doesn't require science. RI, you mean RI? Does that mean Rhode Island? Is that? I'm assuming that's what you mean, right? Study tips for nursing school. So the one thing I'll tell you is to get acclimated. Get into a group. Listen to me when I tell you, get into a group ASAP. Get into a group ASAP because you do 25% of the work. You and 3 other people make 4. You do 25% of the work, split it up evenly, and then come together and you reap 100% of the benefits. There's 3 girls that I was doing that with in school, and it was phenomenal. And if it wasn't for them, I wouldn't have graduated. I'm telling you right now, because we all did the work together, and it helped out a ton. So time management is another tip. Because you have to be able to understand, you have to be able to manage your time. And if you can't, nursing school is going to it's just going to dump work on top of work on top of work on top of work. And by the way, you're still having to go to work, take care of a family if you have one, do all those things while you're in nursing school. Okay. So you have to be aware of that. And that would be my tips. Do you tutor for CCRN? Mr. Everything, I do not tutor for CCRN. I'm not a CCRN, I'm not a certified critical care registered nurse or certified critical care registered nurse. So I don't speak. I mean, although I worked in the ICU for a year, I don't have that certification to essentially kind of like tutor for it because I have never experienced it. So I'll keep it real. I ain't got no issue to tell you that though. I do have some friends that are, but they don't tutor, unfortunately. So, but yes, also Rhode Island does not require you to do science. Well, that's fine. Then just still get the book, but just don't look over the science part, Bianca. So, What other questions do you guys have? I'm going to hang out here for about another 5 minutes. Current job won't work with school schedule. Any suggestions for jobs while in school? Man. So while you're in school, I mean, you can look at anything that's remote, to be honest, because if most of your school is online, then it won't be hard for you to do online schooling except for you have to go and do your clinicals. Okay, that's a really good question though. I like remote work from home jobs. Like me, I was active duty in the Navy, and I was able to make it work. And that's actually unfortunate that they're not able to work with your school schedule. So patient care techs, those are good ones. CNAs, those are good ones. That work, with your schedule for sure. Starting mostly in-person class. Okay, so if you're gonna start mostly in person, yeah, definitely those medical S1s like CRNA. Oh my God, CNA, medical assistant, patient care tech, like those are some really, really good ones. Off the top of my head, I would have to look into that a little bit more, but on the nursing medical side, those are the ones I would recommend. Is the nursing program any harder than Is the nursing program any harder than A&P? Yeah, they're 1,000 times harder. And I'm not playing. I'm not joking either. I'm being serious. Like, if you thought A&P was hard, A&P was a semester. A&P 1 and 2 are semesters. Nursing school, all of nursing school encompassed is what? Depending on your school, 2 years, 3 years, 18 months, 15 months. It's an endurance race at that point. What kind of nurse are you? So right now I'm an OR nurse. And so right now I'm an OR nurse. But I've been working from home for the last couple of months. But OR was my last home, and actually still is my home until I go back. So, but OR is where it is. I was a surgical tech. Well, I've been a surgical tech for almost 14 years. So no, it's 13 years. It'll be 14 years next October. But I've been a surgical tech for 13 years. So the OR is like my realm. It's where I've been for quite some time. So it's a very, very comforting, familiar spot for me, going from being a surg tech to being an OR nurse, for sure. So that was a good question. Starting mostly in person. Yep. All right, cool. So shout out to all 35 of you guys. What other questions do you guys have? About to get off here in about 5 minutes. You guys have asked some really, really good questions. If you guys are new here, we're talking just nursing, NCLEX, nursing school, after nursing school, new grad stuff. So like whatever question that you guys have, please feel free to drop them down in the comments. Also, I want to know who you are, where you're from, and where you were at in your nursing journey. Also, if you're not a nurse, what you doing here? My son just got asked to be a preceptor. Shout out to him. He just like not too long ago just got his license, right? Krista. Because you have a whole family of nurses. I remember that. How to get nurse residency job. Yeah, see, I know I remember. I think I remember it's because your profile picture is like this and you're smiling. So I was like, okay, I remember now. But yeah, hey, shout out to him for being a preceptor. Like, because especially if he loves to teach. Like now he's following in mom and dad's footsteps of teaching. That family of nursing. I knew it. How to get into a residency job. You honestly just apply for it. Find out where they're at, where they're opening, you apply for them. It wasn't hard for me. I found it very interesting. I got a 4.0 GPA. Hey, Bianca, nobody cares about your GPA. I'm just saying. I ain't saying that in a rude way either. I don't want you to think I'm being rude when I say that. But if you found it interesting, you very well could, like nursing school could be a lot less challenging for you than it is for other people. But it's not like A&P. It's not like A&P at all. It's like you have to have the understanding for A&P once they start throwing in the nursing stuff. That was hard work. I'm proud. Be proud of that. Be proud of that hard work. I'm just saying when you get here, like when you get to me, like when you start telling me you're practicing for NCLEX and stuff like that, I'm going to be like, I don't care that you got a 4.0 GPA because guess who's not going to care? That job you applying for. You see what I'm saying? So what I'll say to you is I love the fact that you got a 4.0 GPA, but to once again reiterate, A&P 1 and 2, it really does help lay the foundation. That way when you go and start in nursing school, you'll have an understanding about what you're about to get yourself onto instead of it being completely blind, if that makes sense. So, hey, Kevin, how are you tonight? Ashley, I'm doing good. Hey, how do you like the ebook? That's what I wanted to ask you. How do you like the ebook? And we didn't do any questions today. It was more of just doing some Q&A and, giving you guys some perspective for the next, for 2024. Any tips for someone who is going to start an accelerated 12-month BSN program? I have my master's degree. So you must have got into like a direct, or what is it? A direct entry master level program, I think. Oh, no. I'm thinking of something different. Never mind. Tips for when you start, just like everything else, you're in a 12-month, man, the only 12-month one I know is Texas Tech, and that is fast. Definitely get your time management down. The degree is very different. The process of becoming a nurse is probably very different from the master's degree that you already have. So, what I'll say is time management. When I tell you about this is about to go fast, it's about to go fast. So definitely time management. Same thing. Get into a study group. Y'all are going to be leaning on each other hard. So be very aware of that. That's what I would tell you. That's exactly what I would tell you. Is it Misha? Misha, thank you for the follow. Appreciate you. My daughter is 18, so smart, but got a C in chemistry pre-nursing. My 20-year-old is doing great. You and I both know that C in chemistry don't matter. That C in chemistry don't matter. All that matters is just for her to get into school. That's it. I didn't like chemistry at all, personally. So, user 97, thank you. You're welcome. I hope that was able to answer your question. I really do. Alicia says, you really do make lifelong friends in nursing school. Bond is different. The bond is different. Like they call it like what, a trauma bond or a stress bond. The bond is very different. Like I'm still very cool with the three girls I was with in nursing school. Just like I'm still cool with about 3 or 4 nurses that I was in the ICU with during the second wave of COVID. Like when I tell you, like, it's like not like Stockholm syndrome, but it's definitely, one of those things to where like we most definitely relate to one another for sure. Where I am, it's competitive to get into a program. Grades determine if you're waitlisted. I don't disagree with you. I don't disagree with you because it's not just there. It's everywhere. Like there's a nursing school here that's backlog, like no lie, like 2 years for people to get into a program. So the GPA is very important for you to get into nursing school. I don't disagree with you at all. And so that's the GPA is is literally something that you can control that can separate you from other candidates, as well as look into volunteering, Bianca. Like if you haven't thought about that idea yet, go to like your local hospital, go to the Red Cross and say, hey, I want to volunteer here, and volunteer like once a week or twice a month or whatever. And then when you apply for your nursing school and you slide that in, that you take your own personal time to volunteer at a place of where you want to be employed, nursing school is going to be like, oh my God, yes. And they like stuff like that. So my husband knows everyone. He's 61. I bet your husband does know everyone. Does he know Mark Clemick? Because I'm just trying to shake that dude's hand. So military or bond is like military community. Yeah. But once you're in nursing school, GPA doesn't matter anymore. It only matters just to apply. Facts. Pierre with the gold knowledge. I got a C in chemistry. Got in first try. Graduated without having to retake anything. Can be done. Facts. Surely can be done. A question about the victory guide. What is the best way to view it? I've clicked the link from the email. So Ashley, did it not work for you at all? Because the link should take you to the PDF to where you can download the whole thing. If that hasn't worked for you, send me a DM and I'll work you through it. No worries. We had over 100 apply at my school and had to take an exam. Top 25 got accepted. That's usually how it is. My daughter's pre-nursing and is a transporter. You are correct. It helps. It does help for sure. Exactly. That's the step I'm at. Exactly. Yeah, for sure. All you need, your GPA is important trying to get into nursing school. After that, don't really matter. I mean, it does matter to the point that you want to keep your GPA high so you don't like start failing tests and then next, your GPA falls and then they put you on academic probation or anything crazy like that. So, okay, I'll DM you. Yeah, you're welcome. No problem. And we are down to 17 students. Yep. Hey, that's how the chopping block is crazy. I'm back to tell you I passed my NCLEX. Yes, Lord. That's what I'm talking about. That's what I'm talking about. Ma'am, shout out to you. Everybody right now, Miss, I forgot what your name was because obviously you don't have a name. You got this. Everybody right now, Like tag her, the one that's doing this, right? Tell her congratulations that you're proud of her. First of all, welcome to the greatest shit show on earth, known as nursing, just nursing in general. RNs, LPNs, whatever. So what type of nurse are you? Second, it's Jade. Okay, got you. So everybody give Jade all the love. There you go. As well as if you could give advice to all those individuals studying for NCLEX or even getting into school and getting to that position, what advice would you give them? So shout out to Jade. Jade, you just caught me. I was about to get off. So congratulations, Jade. So proud. That's what I'm talking about. Show love. Pediatric oncology. Okay. About to get that job. That's what I'm talking about. All right. Shout out to all 37 of you guys in here rocking with me. We're just doing NCLEX questions. We're just doing nursing, talking nursing, NCLEX, new grad stuff. I've been a nurse for 3.5 years. I've worked ICU, OR, and PACU, as well as I've been in the Navy for 16 years with 2 deployments, all within the medical realm. Hospital corpsman, aka LPN, as well as surgical tech and instructor. So got a plethora of stuff that I have in my background to bring to y'all, and that's what I'm here for. So shout out to Jade. Jade, once again, congratulations to you. Jade, congratulations. All the best in nursing career. For the next gen NCLEX, there were a lot of who do you see first situations, but most more basic than I thought. Thank you, everyone. So that's what I'm talking. So a lot of who do you see first? Who do you see first is under management of care, right? Which is the largest section on the NCLEX. Any type of review that you use is going to be harder than the actual NCLEX. Okay, it's going to be harder. So when you go and you take your NCLEX, it makes the NCLEX is easier because you studied at a higher and more intense level. ABCs absolutely always save me on the NCLEX. Okay. Any feedback for being an officer in the Navy Reserves as a nurse? What specific question do you have about being a naval officer in the Navy or about being a reserve nurse? Good morning, nurse here in the Philippines. Hi, how are you? Is it Chubby Lita? Is that your real name? Chubby Lita? Because it says Chubby and then Lita. So I just want to make sure. If that's your real name, cool. If it's not, let us know your real name, Miss from the Philippines. Natalie? Oh, no, is it Natalie or Nathalie? No, we're gonna go Natalie. Natalie. Shout out to you, Natalie from the Philippines. I'm gonna come visit the Philippines one day. That's actually like on my bucket list. Do you know what department you wanted to be in beforehand? You talking about like where I wanted to work? Yeah, I wanted to do critical care, and I made it happen. I as soon as I could, I got into the burn ICU, and I was interning there, doing all kinds of stuff. And then I worked there for 6 months, and then I went to a medical ICU, floated I worked medical, but I floated on a neuro, and then after that, I went to PACU. So it says I'm going to put my name on my TikTok just for you. Okay, that's cool. I appreciate you. So I'm not sure yet. So here's the thing, Bianca, is like, you got time. Hey, how are you? Is that Kurarsh? Hopefully I'm saying that right. If I'm saying that wrong, I apologize. I'd be butchering people's names, but I do feel real happy when I start getting people's names right. But yeah, Bianca, I knew exactly where I wanted to go. But the good thing is that you have time and you can essentially go anywhere. You can go med-surg, you can go to NICU, you can go to peds, you can go to tele, you can go essentially like wherever you want. For sure. So, Kate's back. I see Kate back. She might not be back. She might be gone. So, but Bianca, I thought I did, but I actually ended up not vibing with hospital nurses. So, Audrey, I love the fact that you said that, because that'll happen. Like, you'll go, Audrey, I'm assuming like you went there, probably there for about a year, maybe 2 years, maybe less than that. And probably a toxic work environment, probably a lot of mean girl-esque type of things. And then you were just like, bro, policies and all their stupidity that they go through. And you're like, nah, bro, fuck that. I got to go. And then you left. So let me know if I'm like I'm hitting the nail on the head, because trust and believe me, you're not the first person to ever say that. So, and plus how the fact that you get overworked and underpaid and very much underappreciated. Let me tell you something right now. Don't give me no pizza. And trust me, you're going to start seeing people just get, we'll give you a pizza party. No, bro, give me part of that $30 million salary you got, since you met productivity. You know what I'm saying? Like, what the hell? So, but yeah, you are, Audrey, you are very correct in your statement. Hey, if you guys are new here, we are doing just talking nursing, talking NCLEX, talking, new grad stuff, nursing school. If you got any questions, drop them down in the comment. Anybody interested? I have a free download PDF that you guys can check out. That link is in my bio. Also, if you're looking for an NCLEX course, I have one 7-day NCLEX course. That's my baby. That's what I've been working on. There's 60 videos in there. You go over there, you get it, you have it forever. Until you pass away, and then ancestors be willing, you can pass it down to your descendants. So but yeah, you most definitely can check out all those. Also, if you're one of those individuals that needs more like I say, tender love and care, or if you need some more private one-on-one tutoring, how to break questions down, how to understand the NCLEX, how to understand where your issues are, create study plans, start, help you with from start to finish. You guys can check out that link is in my bio as well for NCLEX coaching and mentoring. Everybody's different. So whatever you need, I got you. I feel like that dude in the hallway with the trench coat. I'm just like, hey, whatever you need, I got you. Just minus, all the other craziness that's going on. So can you negotiate right out of nursing school? I assume so, due to a shortage. You would think that, but not really. You can. I personally did not, but you can. I personally didn't because I wasn't really necessarily worried about the technique, or I didn't think about the technique of negotiating, because what they're going to tell you is that you're brand new, you don't know nothing. So they're going to give you whatever the median is when it comes time to work. And you live up in Boston or in the Massachusetts, area. So the cost of living up there is a lot higher than it is down here in Texas. So, you very well could start off at $44 an hour or something along the lines of that. But here in Texas, they start them off at 26. You know what I mean? So it all just really depends. But if you're trying to get a job to get experience, not saying you won't really care about it, but the biggest thing is that you want to get experience so you can make yourself marketable, so you can ask for more money. I did tele for a year and a half, but just didn't like the schedule and probably the acuity. Now, that's fair. That's fair. Ended up liking outpatient and community health type stuff way, way, way more for sure. And I don't blame you. Natalie says, I have my NCLEX eligibility, but I don't have enough resources to study. Can you please send me? You want me to send you some? So if you need NCLEX resources, you can check them out. Check the link out in my bio. I have some stuff that I offer over there. Miss Army Wife, ma'am, you already know I appreciate you. Thank you for the rose. So yeah, Natalie, you can check that out up there as well. Also, if you need like a tutor for NCLEX, I got you as well. Wow, what a difference from the north. So it is very different. It is very different from the north and the south type, right? But also even in California, you get paid more in Northern California than you would down in Southern California. I think Northern California, in the Bay Area, those nurses, with experience, I think on average, they're pulling in over $150,000 to $200,000 a year. However, it's stupid expensive to live there. You're going to be paying $5,000, $5,000, $6,000 or whatever a month in a mortgage or in rent or whatever, So, there's a balance to everything. However, and I do say however, with the rate of inflation and stuff, it makes it very difficult. They start nurses out here at 20 something an hour, but they'll increase them within 6 months by $5. And then every 6 months, they'll try to give them a bonus or whatever. But they gave us a pay increase last February, and it was 58 cents. It was 58 cents. Let me go get some shit with that. You know what I mean? So I'm just saying. But yeah, most definitely is a huge difference. Thank you. Bless you. Natalie, you are very, very welcome. You are very welcome. SoCal, I make $120,000 to $140,000 a year. So North Cal nurses are my level death, make more for sure. Yep, they do. Absolutely. Because that's what I hear. We're North Cal nurses. Of course we make, $120 an hour. And I was like, yeah, but it's expensive as fuck to live up there. So Fanta, hello, how are you? I was supposed to get off here 20 minutes ago. And then, of course, when I say I'm going to get off, y'all come with all the damn questions. So I appreciate you. But Bianca, like, it's expensive to live in California. And you got to think, California, they pay state taxes, which are ridiculous, by the way. I mean, ridiculously high. And they pay federal taxes, and they have all these other like taxes that they pay. It's just all in all expensive to live in California. It says North Cal cost of living is high. Yes, it is. Because like North Cal is like what? Silicon Valley, billionaires, tech giants, all that stuff. All that stuff is in the Bay Area. Why do you think Oakland is acting up? They can't even afford to live, so they're causing chaos. I'm just saying. So I always wanted to go visit San Francisco, but then I got scared and I was just like, nah. But so California. So here's the thing about California: they do have phenomenal weather, but not phenomenal weather to the point to where I'm going to live out on the street. That's just not me. That's not my thing. I lived in California for a year. I loved it when I was in surge tech school, but I was like, bro, I couldn't live here full time. Couldn't do it. Heck yeah, it is expensive to live here in California. Grossly made almost $2,000 and taxed almost $400. That's crazy, right? That's crazy. Now you're just like, where all my fucking money go? What? That's how they get you. That's how they get you. So shout out to all y'all in here rocking with me. I was supposed to get off, but y'all started asking me questions. What other questions do you guys have? We're talking about nursing, talking about NCLEX, talk about whatever. So catch me in my tent. Nah, you ain't kidding. I'm going to drive under the highway and I'm going to see you in Tent City somewhere. So note to self, don't work in Cali. So Ashley, if you are very financially savvy and you know how to do, you understand like what's going on, you could go to California and you could do your thing. But me personally, I don't live in California. I don't have the want, need, or desire to live there like that. Unless I was just bleeding money. And then I'd be like, all right, cool. Here I come. Gaslamp District. Put me up in a high rise over Petco Park. Let's make some shit happen. So, but yeah, here's one thing I can say about California though. Like they have their unions and they have that shit on lock. Like you're getting those lunches, you're getting those breaks, you're getting them. It says, just food for thought. My husband makes more than me. He makes around 70K last year and paid $11,000 in taxes. Lord have mercy. Agreed. It sounds super. It is super expensive. Cali ratios are like the safety, the patient nurse ratio in California is good. I mean, they go on strikes all the time, but they go on strikes for, better pay, better wages, better bitches, better. No, I'm just playing. But y'all already know. That's what they strike for. You know what I'm saying? Tips and tricks for farm, taking it in January 3rd. Man, Queen Latifah, nursing student. I wish you would have been here like a whole 20 minutes early because I literally went over farm like 3 or 4 times. So with farm, you need to understand family name suffixes. You need to understand what medications fall under which family. So what are my cardiac meds? Which, like when you're thinking about cardiac meds, which ones fall under cardiac meds? So your ARBs, ACE inhibitors, beta blockers, calcium channel blockers, digoxin, your antiarrhythmics, right? And then you need to understand safety implications. What are the expected outcomes, the unexpected outcomes, right? Orthostatic hypotension, stuff like that. Once you get an understanding of that, then you'll understand. Like once you get an understanding of that, you'll be able to pick out in a lineup like what a respiratory drug is, and then what to expect from it, and then what I need to do or not do as a nurse when it comes to that mechanism of action. Yep. Or I'll say pharmacokinetics or pharmacodynamics, because I didn't like pharmacology was the hardest thing for me to grasp. It really, really was the hardest thing for me to grasp. And then that just took nothing but practice. So I'm from Alabama. Shout out to you. What are the pros and cons of having a nurse union? I personally don't know. I've never been part of a nurse union, but I can only assume. And as a matter of fact, I think Audrey, are you in a union or Army nurse? Y'all see if y'all can give a little bit more insight. Love farm. Farm is you have to learn. You got to know farm. It says nursing interventions and important side effects. Correct. Yep. Yep. So Audrey is in a union, right? So Audrey, give us the pros and cons of what it's like to be in a union. I have never been a part of a union. I can only guess and speculate, but I do not want to be that individual to just be like, yeah, you do this in a union, and they'll be like, Kevin said that. I'm like, well, shit, my bad, sorry. So it says never been in a union as a nurse. Okay, tracking, got you. Maternity and peds is my weakness. So if maternity and peds is your weakness, then you know exactly where you need to start, don't you, Bree? I've heard about them, but I just don't know a lot about them. Okay, tracking, got you. It says I'm a union rep. We do union. We just unionized. Okay, we help negotiate pay, safe working conditions, stuff like that. Oh yeah, by the way, and since Victoria is here, I have videos on my stuff where I talk about doing going to do union strikes. And I get so much shit for that. I personally have never done one, right? So, but I always find out I always find out the information for people to go out there to make money for themselves, because I don't know. I don't pocket watch you. I don't know what you have going on for yourself. So if you need to make extra money doing X, Y, and Z, then you're going to go do you. Right. But that's another thing I can tell you right now is that union nurses don't like people that cross the picket line. I'm just saying, to me, I think it's funny when people come at me and call me a scab, and I'm just like, or, hey, if you cross the picket line, you're going to get what's coming to you. And then my fucking smart ass is like, what, a paycheck? So I'm just saying there's opportunities for you to make money out here, especially when you start working as a nurse. This is my first union job ever in 16 years. Okay. And the benefits and guarantee raise schedule is great. That's great. I represent the CNAs though. However, it's the same for nurses. Okay. Shout out to that's awesome. I'm in England doing my NCLEX in February. Shout out to you, Marie Q. Victoria, thank you. It says, I'm not sure if any of our hospitals are unionized here. So that's easy. You should just be able to Google that and they'll tell you like if they're unionized or not. Not all hospitals unionized. Not all hospitals unionized don't strike. Okay. Like we're a rural hospital, so we decided not to do that. Okay, got you. About to bridge LP into RN. What should I expect in your first semester, or in your first semester? Well, I mean, if you've already been an LP and you know what it's like, you already know what the first semester is going to be like. So time management, right? And then the one big thing that you need to realize as an LPN. When you're in school trying to become an RN, you need to be ready to turn off what you've learned out here in the outside world and apply book world RN. Okay, that would be my suggestion to you. That would be my suggestion. Okay. All right. So honestly, I'm going to stay on for another 10 minutes. At 7:30, I'm getting off, and 7:30 Central Standard Time because I live in Texas. That's the only time that matters, unless you live in El Paso, because then they're on Mountain Time, and that's different. You know what I'm saying? Is the NCLEX the same in England? I believe it is. I believe that the NCLEX and in Australia, they are the same. However, in order for you to work here in the United States, you would have to take the NCLEX here, unless there's something else that I'm not aware of. But I would have to double check that. Ashley, of course, if you don't become a union member, you can't get your union representation. It's a lot. It's a lot to type out. But if you're interested, you can message me. Look at that. That's what I'm talking about. I just applied for a job. Karam, why you sound so surprised about that? You're just like, oh my God, I got my license. Now what do I do with it? I don't know. Put it to work. You just applied for a job? Well, good for you. Good for you. What type of job, Karam? What type of job did you apply for? Hey, if you guys are new here, welcome. We are talking nursing. If you guys notice, I got my little Funko Pop guy right here, and it says Frontline Hero. I guess it was given to me as a gift because I was working ICU during COVID, and so I was considered a frontline hero, which is cool. So that's why I got it there. I'm pretty sure everybody's like, "Oh, let me talk about this Funko Pop," but whatever, my bad. But we're talking about nursing, talking about NCLEX, talking about pre-nursing, talking about all that stuff. If you guys got any questions. You guys got any questions, ask them down in the chat. It says, no, as a nurse overseas, we do NCLEX anywhere to be a nurse in the United States. Oh, I'm tracking. I got you. Marie Q. I got you. as a nurse overseas. Okay, yeah. Oh, okay. I see what you're saying, because essentially you're taking the NCLEX that's here in the United States, but just overseas. Yeah, you can do that. You definitely can do that. Merry Christmas. Oh, Miss Barbara's here. Hi, Miss Barbara. How are you? Merry Christmas and Happy New Year to you as well. Yes, this is accurate. My friend from Australia had to retake the NCLEX to work here in the United States. Now, if you are taking the NCLEX, but it's based off of the curriculum here in the United States, and you're taking it at a testing center in a different place, then that's different. But based off of my knowledge, the NCLEX that's here in the United States and with Canada is the only NCLEX that allow you to do allow for you to work here, unless you are a nurse. That if you were already a nurse, that's part of that curriculum, and you take it in a different place. So I don't know. It's confusing. But regardless, you'll be a nurse. You'll be a nurse regardless. Now, a lot of those places, like if you work in if you get the nursing in the Philippines or in in Africa, they take their stuff over there. But then when they come here to the United States, or even in the Caribbean, sorry, they still have to take it in the United States. So, but then of course, there's nothing that if anybody has any further questions about that, and I actually need to look into that because stuff changes every day, right? So we can check out the National Council State Boards of Nursing, or ncsbn.org, and they lay out all the instructions and all that stuff that we got going on, or that we need to know, right? Any tips for choosing a nurse residency program? I don't know. Pick the one that you want to go to. That's it. So the thing about the nurse residency program is pick the one that you want to go to. Also, start asking tons of questions, like what are the preceptors like? What are the patient nurse ratio? How long is the orientation? How long is the residency? What else do they have? Be a sponge. Ask tons of questions. Have good preceptors. Don't let people disrespect you, because you'll have preceptors that are just try to be rude and condescending. And that stuff needs to be documented, and it needs to be sent up to somebody that can rectify that issue, because how the hell do they expect for you to do better if you have somebody who is rude and condescending to you? Like I've had two people that flat out were rude to me when I was in orientation, and I went to the director and I told him, I was just like, hey, that person, don't ever put me with them ever again. And I was just like, that person is rude, disrespectful. We kind of had a falling out yesterday or the day before, and I was like, she's fucking rude, and I can't, and I don't want to be anywhere. Don't put me with her. I was like, unless you want me to just quit this job. And they were like, oh, no, we won't do that anymore. And I'm like, okay. So you have to be very vocal. Be vocal. What is your director like? Barbara, are you talking about my director? But is it Say Me or Say MJ or whatever? Hopefully that answered your question. I still got burned on my nursing school. I don't know what that means. Barbara, yeah, you asked that question. That's what I'm asking. Oh, yep, you got it right. Thank you. Okay, cool. Barbara, so you asked, my directors they've been all right. Hey, everyone. Happy New Year. What's up, Miss Boy Mom? How are you? Hey, I love it when I have people that pass their NCLEX and they get their license, that they come here and they still show love. I appreciate all of y'all that come back. So Mary Q says, no, they don't take any exam. They do NCLEX in their home country via Pearson VUE and go to the U.S. as RNs. Well, I've actually heard and seen different from people that I specifically coach, especially I've coached people in Africa and in the Philippines and in the Caribbean, mostly more people in the Caribbean, or the Caribbean, sorry, to where they work there and they have to come here to the United States to take their NCLEX. But I mean, like I said, it all varies. Everything changes. I don't know. That's just based off of my experience of me talking to those individuals that I have worked personally with, right? So when should you start studying for NCLEX? I don't know. I don't know where exactly you are in your NCLEX studying journey. So the answer is now if you haven't. Ashley O'Neill, I will come running when I get my ATT. I'm on the edge of I'm on edge waiting for it. Okay, I got you. I took my NCLEX like a month and a half after graduating. So it all just depends. If you're still in school, you want to start like at least like a month and a half before you graduate. Now, if you graduated and you're out of school and you've been out of school for a while, you want to start studying now, especially if you want to take it, right? Peace, love, and light to you all. Happy New Year. Happy New Year to you too. All right. I have 2 to 3 classes in pre-nursing. Oh, so you ain't even nowhere close. So yeah, for you, is it a SC bling artist and boutique? You don't need to, I wouldn't even worry about NCLEX right now because you won't even understand any of the questions or any of the concept just yet, right? But I would definitely start looking at NCLEX later. And you definitely want to start studying for NCLEX in your last semester of school. Kevin, what's the price of the NCLEX prep right now? So right now, you're welcome. So right now, it's $97. It's $97 for a lifetime. I actually have 60 videos that are in there right now. To include 8 of those videos are strictly for the new generation NCLEX, where I go over case studies. We break down questions. We read the rationales. We talk about those important things that are inside of the NCLEX. But with the new generation NCLEX, I go over 100. What's the word I'm looking for? I go over 100 questions. And then at the end, talk about, how to study, breakdowns, memory tricks, stuff like that. So, Victoria, that's what's in it right now. And I'm working on right now, some other videos are getting edited and hopefully they'll be up here within the next couple of weeks. So is it good for Canadian LPN provisional tests? Yes, because you guys take the same NCLEX in Canada that the US takes. So it says, I'm great getting used to saying I'm a nurse. I bet. Hope y'all had a great Christmas. Took NCLEX 4 times. Keep pushing y'all. Let them know. Let them know, boy, mom. It doesn't matter. Doesn't matter how many times you take that exam. As long as you get out there, you improve upon what you didn't do well on, pass it, go out there, start working, doing your thing. No job's ever going to care. No job is ever going to care. All right, ladies and gentlemen, I appreciate everybody in here rocking with me. It is now 7:30. I stayed on like a whole hour and some change longer than I wanted to, right? But I appreciate everybody. Hey, I'm going to leave you guys with some questions to ask yourself. Think about where you started at the beginning of this year in 2023, and then how far you've come when it comes to improving from where you were. We appreciate you, my friend. Victoria, I appreciate you. Tell your husband I say what up. And so think about that. Think about where you were, and then carry that over into next year, and then keep improving upon yourself to make yourself better, even as a person, as a nurse, as a mother, as a father, whatever. It's consistent growth. Okay. So that's what I want to leave you guys with going into 2024. All right. So last little non-shameless plug, because I'm not shameful for it at all. Anybody that I have a free download, you guys check that out. That link is in my bio. Also, I got an ebook. Over 700 pages of important stuff that you need to know. By the way, Ashley, I'm going to be reaching back out to you. I see that we were talking, so we'll talk about that. Also, I have an NCLEX course. You have it forever. You get all the updates. Right now, it's for $97. If you need something more, like if you want this, you and I, to where, we talk about your pain points, how to improve upon where you were to get you to where you want to be, aka failing NCLEX, aka nervous about NCLEX, to talking to me, getting you on a straight and narrow, to passing the NCLEX on your next attempt. Hey, I do coaching. I do mentoring. Let's see if we can work. Let's see if our relationship is great enough to where we can work together, so I can take that pain point away from you and help you hone in on what you need to hone in for yourself. Okay. But ladies and gentlemen, I appreciate everybody being here. That's my last shameless plug. Non-shameless plug, but I appreciate all of you. I appreciate what a great year you guys have done for me, but most importantly, what you have done for yourself. Be kind to yourself. Have a great new year. Be safe. Next live is going to be, fuck it, I might just do it on Monday, but some of y'all might be hungover. But I don't know. I'll decide whether I'm going to do it on Monday or do it next Wednesday. But I appreciate all of you. Be safe. Come into 2024. to where I can see all of your bright and shining freaking types out in my chat. But 2024 is going to be great. I want you guys to be on the lookout for a bunch of stuff I got coming. But y'all be safe. See you guys in 2024. Bye.